Yeah, because I know if I say no to it now, then it won't work next time. I just know. Okay, so let me just, I think I'm just waiting to make sure this works. I just know. Okay. Okay, so we'll get after
Okay,
this.
let me just,
Hi, everybody.
just waiting to make sure this works. I just know.
I'm just
Okay,
gonna, we'll get after
okay,
this.
let me just, everybody, just waiting to make sure this works. I just know.
I'm just
Okay,
gonna,
we're good. Okay, let me just.
okay, I hope that's still on YouTube. I wonder if someone could check that for me. Let's see, maybe Melanie's here yet. Okay. Let's see, am I still on YouTube? I hit something. I don't I don't know. I'm just getting, let's see. Hi, everybody. Um, just let's see. Melanie, are you here? Melanie, are you here?
Yeah, I just looked and it's there.
Oh, okay. Okay, great. Thanks. I don't
It's kind of double. I'm hearing both.
right. So turn it off. Turn off YouTube.
Just
So if you turn it off, right, you
say,
don't
Melanie, are you?
yeah, everybody turn off YouTube so you don't hear it.
Yeah, I just looked and it's there.
Okay. Okay. And what I'm going to do, I'll edit this beginning piece out of YouTube once I can, after the episode is done, I'll edit out tonight. I'll edit out this beginning part where we're just chatting. But anyway, hi everybody. If anyone wants to just share anything or say hi, or if anyone is new and has never been on a Zoom call with us, or write in the chat where you're from and what, I mean, it's been a storm here. I live in New Jersey and it's been so bad today. I said to Dr. Millman, I'm like, I hope I don't lose electricity. That's how bad it was. It was like crazy today. It seems okay now. But how about everybody? Let me know where everybody's from. You can just put it in the chat or just say you can just unmute and chat now. We're just having fun before we start.
Margie, I put my questions in the chat. I hope it's
Well,
okay.
you know what? How we're going to do it, Yvonne, raise your hand because that's how we're going to do it. And if absolutely you can't figure out how to raise your hand, we'll go to the chat. But raise your hand. That's a better way. That's how Dr. Millman asked to do it because we'll just go person to person. If you don't want to show your video, we'll still ask your question, but your video, it was going to be shown and we're just going to go. It shows us the order of the
I
question.
can't find the hand.
You can't find the hand. It should say, it always changes at the bottom. I think it's under reactions. Is that where everybody's seeing it? To raise your hand?
So there's a heart down at the bottom. It's about the third icon over, the shape of a heart, and that says react.
Okay.
You did it.
Okay, great. Yeah, I haven't raised my hand. They always change it. It's like changed like 10 times. Sometimes I look at my computer and all of a sudden, oh God, you got it, Yvonne. Perfect. Okay, so you're in.
And
Everyone
I can't see myself. I don't know where I am.
You're good. Oh, all of you will get it. I mean, truly, this will probably last. Well, Dr. Millman, for those who know her, is so incredible. Like she'll stay for 5 hours, but we're not doing it. I said, no matter what, the absolute, so it's not going to last more than 2 hours, but it could go. So you can leave. I'm sending everybody on my list, everybody who's on my email list. I'm going to send the replay tomorrow. So don't worry if you feel you have to leave, not a problem. But if you want to ask your question, we're doing them in real time because it's just easier for Dr. Millman and, you know, so for those people who are in my community, I always have everybody send their questions in ahead of time. And then this way it lets me look things up or if I don't, just get the resources. But there's too many people and this works out well. So and well, good. So anyone else? I actually want to get one thing up here. I'm listening to all of you. I just want to make sure I have these. I just wanted to show you something in the beginning. Anybody have anything they want to say, or what's just read out the weather? Just let me hear where you're from. You can just unmute and let me know. That'd be fun. Okay, that's perfect. Just doing that play. Okay, we're good to go. That's weird. Okay. Okay, I am back.
Hi, Margie. It's Mary Beth. I saw you at the Health Conference.
Oh, hi Mary Beth. How are you?
Good. It was great to see you there. I just wanted to chime in because you asked us to. It's storming here in Atlanta.
Oh, is
So,
it?
yeah. So, but
Yes.
that's okay.
Yeah,
It's
it was, I mean, it was really awful. It was funny because this morning it was sunny, beautiful. I went and did my exercise and I knew it was supposed to rain. And my plants, because it's been so hot, really weren't looking good. Like I like to get water first thing in the morning, but I'm like, no, it's supposed to really rain. And it really rained.
it's really raining. So, yeah. Okay. Hello to everyone. Can't wait to listen to Dr. Millman. Bye.
Bye. Thanks for saying hi.
Hi,
Let's,
Margie. My name is Beth,
hi, Beth. How are you?
and
Where are you from?
I'm checking in from Kalispell, Montana, but I used to be a Jersey girl.
Oh, really? What part of New Jersey?
We lived in Middletown. I kind of grew up in Bergen County, lived in Middletown, and used to work in Piscataway, so right in your neighborhood.
Yeah, Morristown. And I grew up actually in Spring Valley, New York. So all
Oh,
our shopping was in Paramus, because you.
do you remember the Spring Valley Drive-In, or are you
Oh, yeah.
younger than
No,
I
no,
am?
no, 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 no. I do. Yeah.
Friday night at the Spring Valley Drive-In. But I just wanted to say, my mother had osteoporosis. I have had osteopenia since I was in my 40s. I'm now 70. I've had osteoporosis a couple of years. Your work has just changed my life. I just want you to go to bed tonight and think, what I do matters.
Oh, you are
So thank
just
you very
so
much.
sweet. Thank you for saying that. That's so very kind. I mean,
Really, it's made a huge difference because I thrive on understanding the condition and understanding all of the root causes. And I happen to have had so many of them. I was gluten sensitive. I've been gluten free for 22 years, but I was
wow.
gluten sensitive, did IgG, turned out to be dairy sensitive, egg sensitive. So my body is throwing all these antibodies. Anyway, thank you, thank you, thank you for
Oh,
all the work you've done.
you're so sweet. The truth is I love what I do and I feel so lucky that I'm able to, bring this. And that's why I'm so happy that Dr. Millman and I connected years ago. But that, that's my philosophy is the education and the knowledge. Knowledge is power.
Knowledge is power.
And that's the people who seem to come to the community, or people who don't want to be told, just do this, this, this. They want to understand exactly what's going on, why they're doing this. Because to tell someone to do something, that's not what we want. We want to be empowered to understand the whys, what we're trying to achieve, and then it's doable and being better than you were to begin with. So
Yeah,
that to me is why I can keep doing what I'm doing and really love it so much. I always meet new guests and new things I learn, and I just love sharing it. So yeah, thank you.
absolutely. And
Thank
a shout out to your husband too. What a guy. As a gluten-free person, I really appreciated his story
Yeah,
on the
isn't that?
podcast a couple of weeks ago. So thank you.
Oh, yeah. For those who don't know, my husband's an OBGYN, and I mean, honestly, he wouldn't be alive. It's really, really true. And we're connected to all these. He's a conventional doctor, but it's not really anymore because he's been around me so long and really understands the integrative approach. But he's not trained. He's trained in regular OBGYN. But years ago, I mean, it's been, I don't even know how many years ago, a really long time ago, he was so sick and no one knew what was going on. He's losing weight, he's sweating, he's barely making it through the day. He got so skinny. I mean, and no one, they're like, I'm sorry, nothing we can do. And it ended up, and they didn't, he used to not listen to me. My whole family are doctors. No one ever listened. And then at the end, I'm like, look, if I'm willing to help you, but you have to listen. And so then we found out he had a gluten issue. We got tested, and his body was it's a too long story, but basically he's doing great. But he wants to share that, and he does. He shares it with all his patients, and when you can't figure out what's going on, get rid of the gluten. And so now years, oh my God, people have improved their ADHD. This one woman, right, 25 years. I don't did you hear that part of the story? She was coughing 25 years. And then she got off the gluten and the coughing stopped. And her husband, they're like hugging him when they came for the visit. We can't believe this. Anyway, all good. So thanks. I'll tell him that you said that. He'll appreciate it. Let's see, because Dr. Millman's coming in a couple minutes. I know she's coming in. Anyone else want to just share where you're from or say anything while we're just blabbing away before we get started? And make sure when you come on, if you have a question, raise your hand. That's how we're going to go through it. So if you don't know how to go to reactions, that's at the bottom, and just type it in. You know, don't type it in. Just raise your hand, and then we'll go in order. And
Margie, can you hear me?
I can, yes.
I got a quick question. I have been looking for your interview with Dr. David Minkoff
Oh,
about
it's
perfect
on
amino.
my summit. It's on my summit.
Oh, that's why I can't find it.
Are you in the community? Or
I
you?
am, and I do have access to your latest summit.
Oh, great. So it's in there. Yes. And I'm
It's in
actually
the summit.
have him back. I'm going to have him back on the podcast. So if you have specific questions, because it was such a good interview, and I love those perfect aminos. They
Well,
are.
I just keep telling my friends about the perfect aminos, and they're like, "Well, why should we take them?" And so I was looking for your
Yeah,
podcast.
just go, if you have the summit, then it's in the summit. And
Okay.
it's interesting because I've been taking the perfect aminos for those who don't know, they're amino acids, and it's just a great way to get protein, but it's a really phenomenal product that Dr. David Minkoff created. And it's on full script. I mean, it's easy to get, but I've been taking the pills, and I re-listened to the Summit interview recently, and he was saying how he took, when he would have his decaf coffee or whatever, he would put the mocha flavor in. And I don't like powders at all, but I thought, let me try this. So I bought the mocha. It's delicious. It's like such a great way. So now in the
Yeah,
coffee.
I bought the mocha first and was putting it in my coffee, but I kind of like the chocolate better, so I put the chocolate in my
I
coffee.
haven't tasted anything else because I usually don't like powders.
If you think about it, try chocolate. It's a little better.
Oh, really? The mocha was like so good. I was
Who
thinking,
knows? I mean, everybody's different, but
yeah, yeah.
Margie, I got the lemon lime and I put that in my yogurt and it tastes like a dessert.
Oh, really? So they're all good. Wow. The lemon lime?
Yeah, I like that one the best.
Oh,
I
so
didn't like the strawberry. I thought it had a metallic taste, but that was just me. But
well,
I,
Dr. Millman's class, everybody liked the strawberry mixed with water. And I thought, I'm not a strawberry person, but they really like that one. So
I find it doesn't dissolve well in water. Maybe it's the water here, but when I put it in water, half of it's still on the glass after I drink it.
oh, I use that. I bought one of those little frothers for coffee, and I stir everything up with that.
Oh,
Works really well.
Yum. Yeah, it's just funny because I'm not a powder person. I typically don't like fake taste, and I don't like all that, but I don't know. That was I thought, let me just try this. And it was like that I like. And the creatine, I like the taste of that. That JJ Virgin has this creatine that also tastes good. There's only the two powders I think are good that have like actually a flavorful, good taste in my mind. Other people like lots of things, but
Well, I take the pills and then the 4 pills a day, and then I splash a little bit of in my coffee for flavor. So I do both.
yeah.
yeah, Margie, if when you're traveling, it's better to take the pills
Oh
because
yeah. Oh yeah.
the powders ain't messy, and then the people who are in TSA and all
Oh,
that come through with a powder and they don't know what it is, and it can really mess things
yeah,
up.
I agree. The only kind of powders like from collagen or something, sometimes you can get them in, when they're in packages, like in single dosage and stuff. But yeah, that's a good point. Okay, we're almost going to start soon. Oh, hi, Kathy.
Margie,
How are you? Yeah.
can I ask you one quick question? Can you give the link or the website that you've talked about before for trying to find a physical therapist who really knows how to work with people with
Yeah.
osteoporosis?
Okay, so there's a couple things. Okay, so ready? So,
Yes.
oh, and I have to find Melanie to make her co-host. If you're here, Melanie, just show your.
I'm here.
Where are you? Oh, hi, Melanie.
Yeah, hi.
Is my wonderful person who's been helping me so much. How's the weather in Canada? Melanie lives in Canada.
I do. It's beautiful actually right now. Really, really warm.
Oh, wow, great.
Mhm.
Oh, good. Because now it's not bad. It's been like really stormy here. Okay, so you're a co-host, and I'm going to make Dr. Millman co-host when I see her. Okay, ready? So this is how to find a physical therapist. Number one, you can go to Bone Fit is a certification. It's from Canada and it's a program. So there are physical therapists who are certified in Bone Fit, and they have good knowledge and they have the basics and they really understand. So I'm pretty sure I made like an easy way to find it. I mean, if you go to the Bone Health and Osteoporosis Foundation or even Google Bone Fit Physical Therapist, you'll find it. But I made one called tinyurl.com/PT Bone Fit. So Melanie, just make sure that's right. I'm like 99% sure I didn't put Bone Fit PT. I'm pretty sure I put PT Bone Fit. So that's one. Those people, they'll give you a list of people in your area so you can, you'll put in your zip code. So that's one way. Number two way is you just go to choosept.com. That's by the American Physical Therapy Association. And the two things to put in are you can put in you put in either geriatrics or women's health, and then they'll give you, and usually that's where people who have with osteoporosis. The other thing you can do is see if there's no narrow program near you. That's the bone, that's that amazing program from Australia. And if you just go, well, I guess you just put I don't know if you put the Bone Clinic or Onero licenses or I can get that for you and put it with the replay. But that's another place where I think it's an amazing program. I personally do that. And then lastly, what I would do is check with your insurance, because at least in the United States, physical therapy is covered by insurance. So check in the call your insurance. Who do they cover in your area? And then just call the clinics and just see, do you have anyone that specializes in osteoporosis? And they will tell you, because you want someone that really has the background. And, so that's what I would do. If you have other orthopedic issues, there's something called an orthopedic clinical specialist. So that person has more training in orthopedics. But I think for everybody here, osteoporosis, you want someone with osteoporosis.
Thanks so much, Margie. Thank you.
Okay. Oh, you're so welcome. Okay. 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 I didn't record that. Someone else is recording, but that's okay. Okay. So Dr. Millman, are you here?
I am here.
Oh, there she is, the one and only. Okay, so
Hey, everybody.
I didn't mean to pin you. I meant to make you I meant to make you a co-host. Let me move you. What happened here? Let's see. This meeting is being recorded, but that's not my recording. So let me fix this up. Wait, I'm putting you back on and putting you as co-host as well. Hang on. Okay, let's see where you are. Hang on, everybody. That's interesting. So we tried this earlier, right, Dr. Millman? Because I was making you co-host and making, yeah, I don't think I can make two co-hosts on this. All right. So on that note, I guess you don't really need to be co-host, right? You're really not doing anything. So I'll leave Melanie as co-host.
I'm
And
not doing anything at all.
other than running the entire thing, but I mean, you're not doing you're not doing managing. Isn't that interesting, right? We did that earlier, and we saw we could do two co-hosts, but I only see.
Yeah, that's right.
Let me try one more time. No, I don't see that I can make you a co-host. Isn't that strange? All right. Well, I'm going to leave Melanie. Oh, I can. We got this. Okay. So make Dr. Millman. All right. So we're good. Now you can have control as well. Okay. Oh, confirm my speaking language. No, it's not Spanish. It's English. Isn't that funny what happens here? Okay, yes, we are in English. Okay, so what I'm going to do, I'm going to put you with me, Dr. Millman. We're going to pin ourselves. Okay, let me put myself as a pin. And
Are we supposed to put questions in the chat, Margie?
no, how it's going to, okay, so let me record it. I'm going to, yeah, I'll just tell you, and then before we record it. No, don't put them. Well, the ideal thing is to raise your hand, and we're going to go in order for everybody who raises their hand. So if you look at the bottom, you'll see like circles and things. You'll see. Does everybody know how to raise their hand? You'll see. It says react in like a heart for everybody. And so if you look at the bottom, you'll see like, are some people listening on YouTube? So okay, what we're going to do here is mute for a second, everybody. You'll see everybody. It says react in like a heart.
Here.
And so, okay, So let's
At the bottom, you'll see them.
Can everybody mute,
people-
please?
everybody mute, and Melanie, you're in charge of muting everybody. You have the the muting role. Okay, so what I'm going to do, I'm gonna tell everyone to unmute shortly, but not yet. So here's the plan. I'm gonna push record, and then Dr. Millman and I are gonna talk to you for a couple minutes, and we'll get started. And then, but before, well, I'll tell everyone in a second. Okay, let me just hit record myself since I didn't do that yet. Time is it? Okay, we're good. Okay, let me just make sure it's recording. Yes, okay. Okay, welcome everybody to tonight's Q&A with Dr. Kim Millman. And I think all of you know me, but for those who don't, I'm Margie Bissinger. I'm a physical therapist and integrative health coach, working with bone health for it's really over 30 years now. And I'm so excited to be here with Dr. Kim Millman, who is really an absolutely amazing integrative physician and PhD who has specialized in bone health for over 15 years. And we met quite a while ago, and instantly I just loved everything that she has done and does. And we sort of just hit it off and complement each other. We have different areas of expertise. And so many years ago, I said to Dr. Millman, you're only one person. You can only do so much. And I said, you have to create a course. And then she finally did. How many years now has it been, Dr. Millman?
2.5.
2.5. And so then she asked me to do part of the course with her. So we've been working together now for 2.5 years. And I'll tell you in a couple minutes about other things we're doing. But I always love when she comes to the community because she has such an incredible depth of knowledge. And as we were talking about before, people in this community want knowledge. We don't want to be told, just do this, do that. We want to understand. And then with the knowledge comes power. And we're empowered to make these positive changes for both our bones and our health. And this integrative approach really, really works. So I'm so excited you're here. Before we start, because as I said, Dr. Millman's going to stay. We're not just going to end at an hour. We're going to go longer. And so I know sometimes people have to leave, and I really want to appreciate everyone's time. But I just wanted to share a few things before we start that I'm so excited about. So actually, before we start, for those who know me, how I start the class, I'm going to change the view for a minute before we do anything. Okay, so I can see. Now, if you don't want your faces on, you don't have to show them, but it's always so fun to see everybody. So for
Margie,
yeah,
it's Melanie. Can you just double check that you're recording?
does it not look like I'm recording?
It doesn't look like you're recording for me.
It shows recording. Does anybody else?
I can see it says this meeting is being recorded.
Yeah,
Okay.
it says record.
Okay, so we are
Okay.
being recorded and we're on YouTube. So
Okay, perfect.
we have a backup. Okay, so for those who know me or who are in the community or have been to any of my classes, know how I start. What we're going to do is put an intention out there. I want you to think you're going to get something from tonight, whether it's your question or somebody else's question, that some bit of information that's really going to make a positive impact on your bones, your overall health. Something really good is going to happen from being here tonight. So just put that intention out there. And I love to start with good energy. I just like to get the field going. And this way we'll juice up Dr. Millman. So you can unmute. So everybody unmute for a second. Okay. And on the count of 3, we'll just say hi, good energy. Ready? So put that intention out there, something positive. And are you guys ready? Okay, ready? 1, 2, 3. Hi.
Good
energy.
energy.
Good energy.
Okay, Dr. Millman, are you going to stop? All right, so everybody can mute now, and Melanie, make sure everybody's muted. That would be really helpful. Going to change the view back for a second. And what I'm going to do also, I just want to share a few things before we start. So, because I don't want to, if you have to leave, to miss out on this. And I just want to say a disclaimer that okay, just a disclaimer that the information in this program should not be construed as medical advice. It's not intended to replace consultation with your physician or healthcare provider. So on that note, okay. And the next thing I just wanted to tell you about is Dr. Millman's program because this is happening soon. I know I've sent some emails out about it, but I just wanted to tell you, she'll talk about it more afterwards. But if you have to go, it's just, if you like this question and answer and you want more of that, this program is happening. It's happening August 16th, it's starting, and it's really an amazing program. I'm not going to go into it all now. It's 10 weeks, and it's just filled with deep dive, understanding the testing, understanding root causes. And if anyone's taken it, you can write in the chat how you've enjoyed it. But it's really a great program. And there's an early bird that it's $797, but with our discount, it's $697. So it's like $500 off until August 8th. So if you are interested, definitely check it out. It's just the millmanclinic.com R&R, and there's a QR code here. So it's Happy Bones F for fall 25. That's our coupon code. Anyway, I just wanted to tell you about that for people who do want to do a deep dive. And the reason that I really think I forced you into this, Dr. Millman, because I kept bugging you. And because I didn't know that you were really going to do it, because I just felt there's only one of her, and people ask me, who can I work with? And sometimes there's a doctor close by that's integrative, but oftentimes there's not. And so that was sort of why she created this course, teaching you how to interpret the testing, what testing to do, and you can do that with her guidance, and you'll see how she answers the questions tonight. Anyway, so that, you can really look into this for more information, but it's really good. And I teach 2 of the classes there too. Anyway, the second thing I just have to say, and this is only for practitioners, so I don't know how many practitioners are on this call, because I didn't really make this special for practitioners at all. However, if you are a practitioner or no practitioners, this is something that I asked Dr. Millman to start the other class. This is one she asked me to start. She said, not that to start, but she asked me if I would join her in this mission. And we decided that since there's only 2 of us and so many people want guidance, need more guidance, or, could use like a health coach, could use someone, practitioner to work with, that there just weren't enough practitioners. So she asked me if I would join her in creating a practitioner course. Anyway, so we're doing that, but what we're having is a live webinar for practitioners on how they can work with clients and identify root causes. So if you're interested, if you're a practitioner, again, this is just for practitioners, or practitioners who might be interested, they can sign up here at bonehealthacademy.com/testing.webinar. We'll have this in the show note, not the show notes. We'll have this with the replay. But it's here also as a QR code. And Melanie, maybe put it also in the chat. So I think that's all. Oh, yeah, and this is the program that we're talking about. We created the Bone Health Academy so that Dr. Millman and I are going to train people on this restore on her class, and all the information on testing and how practitioners, so there'll be practitioners to work with. That's our goal, because it's a big mission and the integrative approach works. And anyway, that's all I'm going to talk about. So I'm going to stop here. I'm going to back to you, Dr. Millman. And I just want to say, Dr. Millman, why don't you tell people, because we're going to go through this and I'll put people up to ask who raise their hands, but why don't you just share how you're legally allowed to answer questions and how you want people to ask questions on this Q&A that I'm so excited about.
Yeah, absolutely. So, as you probably, some of you know, I'm a practitioner and I'm an MD, PhD integrative physician who's working in California. My license is in California, so I can't legally answer and give you medical advice. So if you could please make your questions general concepts and take out any kind of lab data. And also, I have certain specialties, right? I am not a medications expert, and I certainly don't want to go into really complicated integrative medicine topics like mast cell activation, Lyme disease, any kind of stealthy infections, that kind of thing, because it's just too complicated. Cancer, too complicated. We want to just like focus on the basics, those things that are really going to be pertinent to most people in the audience. So I would actually just ask you to refrain from asking those kinds of questions and just directing things to the most pertinent bone root cause questions that you can.
And if for some reason you do want, someone, a specialty, write it in the chat because there are so many people that I've interviewed on podcasts and things that maybe, but don't ask it as a question, as Dr. Millman said. All right, Dr. Millman. So I am going to go through, I'm going to leave you, remove my pin. So you're going to be the main person here. And I'm just going to, I think my easiest way is to let me just find all the prep. Let me see everyone who's raised their hand. And usually it's in order. Hang on a second. That was the whole point. Let me go back here. I'll do it this way. This is fine. Okay, so so the first person is Phyllis. Are you there, Phyllis? We can move
Yes,
from.
I'm
Okay,
here.
Phyllis, hang on. Okay, Phyllis, you're on.
Dr. Millman, thank you for this workshop today. I really appreciate it. And you too, Margie. Can you just talk for a minute about semaglutides and how those of us who are interested in them with osteoporosis, is that something we need to just really steer away from? Or are there some benefits there for us in those medicines?
Well, I use semaglutides, the GLP-1s, a lot in my practice, mostly for people who are interested in weight loss. But what I find is that they are really amazing metabolic drugs. So I'm seeing improvements in lipids, in insulin resistance, and also in inflammation markers. So as you know, all three of those things are root causes for bone loss, and so from that perspective, they can be really good. The kind of the cons of the GLP-1s is the effect that it's going to have on your digestive system. So it does slow down digestion. So if a person has constipation, can cause sort of a backup of sense of in a sense where you can have nausea and heartburn. And so if there are digestive concerns, then person should maybe consider that. And absolutely, if a person is on the low weight of low edge of normal as far as weight, losing weight would not be advantageous for a person. So if a person's overweight, has metabolic parameters that they're worried about, it may be a reasonable drug. The other thing is that there is an issue with maintenance. Although there's some supplements out now where you can do those as maintenance and really also dial the dose back on the GLP-1s. So is that helpful?
Yes, thank you so much.
Yeah, you're welcome. So Phyllis is saying that they're not able to see me on the screen. Is that true?
Oh, no, I can see you on the screen.
Okay, great. Thank you.
I see you on my third page. Usually it's on the first page when you're sharing.
Change your view. Go up to the right corner. It says right top, it says view. Click on it, say multi-speaker. Check that. Click that.
Oh, okay.
You can also click pin and she will be on your screen.
I think Margie has already pinned me.
You're good.
Yeah, so Susan, call our clinic. We're in the South Bay, and San Mateo is just right around the corner from us. Call Lauren. I know that we have a wait list into November, December, but you can call Lauren at the clinic and find out if we can get you in. Okay, Margie.
Thank you.
I muted myself. Okay, Risa, you're up, so you can unmute.
Hello, Margie. Hello, Dr. Millman. So nice to have you guys be doing this. Thank you. So Margie, I listened to your Bone Health Summit. I think it was a few months ago, and I'm turning 65 next month. My mom just turned 90, but she it runs in the family, the osteoporosis. And so my question is, I want to get a baseline bone density test since they told me I need to wait till 65 to get that, or they like to wait till 65 to get that. So my question is, what do I need to know about just baseline testing, the bone density test, or any other? I think I remember there was some other information about some other kinds of markers that need to be tested too as a baseline, if you can speak to that.
Mhm. Well, this is a big subject, but let's just start with the DEXA scan. So it does sound like maybe you're at Kaiser, because Kaiser has a policy that they don't test for DEXAs until after 65, which I think is the wrong approach. I would like to see all women in their perimenopausal years actually be getting a DEXA scan, because as some of you probably know, the point at which you lose the most bone density is perimenopause, this 5 to 6 year period right around the final menstrual period. So we really want to know in the perimenopausal period what the baseline is for a woman or a man. And the gold standard, of course, is the DEXA scan, and getting a TBS, which is the trabecular bone score, is a good way to get a quality measurement, which is also pretty widely recognized now as being accurate. And so if someone wants to get their first DEXA scan, I would absolutely recommend going to a facility with a TBS capability and getting that as your baseline. And then the other markers that you might be thinking about would be some of the bone turnover markers. The two that I use are CT low peptide, or CTX, which is a bone breakdown marker, and P1NP, which is pro-collagen of type 1, it's pro-peptide of type 1 collagen. So getting a CTX and a P1NP, it gives you an idea of your stability. And if you're just, going down this journey, then you really need to advocate for yourself. And I would say that if your physician won't test you for a DEXA, to take the initiative and to get one out of pocket.
Is the other bone turnover markers, is that a blood test?
They are blood tests. That's exactly right. And they're very important to be done properly. So they need to be fasting, taken as early in the morning as possible. No biotin, collagen, or bone broth for 48 hours before the tests. And that is very important. And your optimal range for CTX would be 250 to 350, and P1NP is roughly a tenth of CTX or more. So if your CTX is 350, you'd want a P1NP that would be 35 or more.
Okay, great. And can I just also ask you about supplements? How do I know? I know that's a big subject too.
To tell you the truth, I would appreciate if we all just stick to one question a piece, just for, the interest of allowing other people to be able to talk.
Thank you.
You're welcome.
Okay, and just one thing I wanted to add in terms of when you go, sometimes they only do one hip. You want to get both hips, because sometimes something can happen to a hip. You can have a total hip or something, and then you don't have that information. So a lot of times the place just says, oh, we only do one. And I also like people to do the wrist too, just so they have as many areas as possible. Okay, let's see who's next. Is Cindy Fogel? Is that you? Okay, Cindy, you are on.
Thank you, Margie. Thank you, Dr. Millman. This is such a blessing for all of us here on this webinar. So I'm trying to word my question in a way that will fly under the radar. It has to do with bone loss, where bones were perfect at a DEXA, probably age 45, something like that, and had a history with an oxalate issue with the great Dr. Solomon's back in the day in the vulva pain clinic, and knew of an oxalate problem and did the whole oxalate diet, and for some reason thought that all of those symptoms seem to have gone away. And so was eating from my doctors, my functional medicine doctors, oh my gosh, that book, Toxic Superfoods, just eating all of the very high oxalate foods, spinach and everything, and Swiss chard and beans, and then all of a sudden, poof, had 4 compression fractures that I didn't even know were vertebral compression fractures. So curious about how oxalates, like what is the chemistry or the disease process, or do the oxalates leach out the calcium? Because it was just, there are no other underlying, everything else has been tested, all the markers that are fine. No other smoking guns. So curious how the oxalate diet or high oxalates contributes to bone loss. And yeah, thank you.
Yeah, it really is mostly through the mineral and the nutrient depletions that it causes. So it directly binds with some of the positively charged minerals, including calcium and magnesium, as well as potassium, iron, the B vitamins. So it is depleting these minerals and nutrients from the body. And so it's not allowing these minerals to bind to the hydroxyapatite crystals and form a good solid bone. And the other thing is that these oxalates are like little shards of glass, and they are inflammatory, and they are very tiny. They lodge into almost any tissue. And this describes why these oxalates can cause such a wide variety of symptoms, because they can go anywhere in the body. And so as an inflammatory compound and as an anti-nutrient are their main mechanisms of action. And so and also as they can even bind the calcium within the bone and pull it out. So that's the main mechanism of action. And quite often, I mean, you were saying that in your opinion, there are no other smoking guns, and almost always, a person needs to know what their CTX is, and their CTX is 600, and they have gone on a low oxalate diet and oxalate clearing mechanisms. Anything over 400 is for sure bone loss. So if a CTX is 600, there's another smoking gun, right? You just haven't found it. And in a postmenopausal woman not on hormone replacement, usually it's lack of estrogen, and possibly lack of progesterone and lack of testosterone. And the 2 biggest drivers for patients in my clinic and what I've seen is hormone loss and not enough weight training. So those are the 2 biggest needle movers as far as really being able to rebuild bones.
Thank you. The CTX and the PN1P were great according to when I had it tested, which was, and I did the fasting and the time of day, and that's why the oxalate thing seems to be the culprit in my very civilian, lay understanding of all this.
Well,
But
just also realize that if a physician or a practitioner who doesn't deal with bones on a regular basis may have a different optimal CTX range than I and some other top experts in the field. So just remember that, mine is pretty conservative at 250 to 350. Anything over 400 is absolute bone loss, no matter what the P1NP is.
thank you so much.
You're welcome.
Okay, let's see. There is one person here who's on a crazy time schedule. Where's Carolyn? I don't even see her. She's calling. It's like the middle of the night, where she is. And I know she raised her hand. Are you here, Carolyn? Just say yes, because I want to honor your time since she's, okay, well, we'll keep going in order then. If you come up, Carolyn, okay. So next person is Tanya. You are on. Hang on, Tanya. I will. Okay, Tanya.
Did you mean Tony?
It looked like Tony was before me.
Oh, was Tony? All right, well, let's do Tanya and then we'll get to Tony. Did I miss Tony? I'm sorry. Okay, but Tanya, you're already up, so why don't you go?
Okay, thank you. I think a quick question. For somebody that was in the osteoporosis range, had a REMS test in December, how often should that be? I just got notified that they're doing it again. It's like 6, 7 months. Is that too soon to test again, or what are the guidelines?
I would say hi, Tanya.
Hi.
So I would say that it all depends on what you're doing as some treatment regimen, right? So, I had somebody in clinic the other day and she really wants to do almost everything through food. And so we're not going to test very often because we're not going to probably see very much difference, right? If you're working on the gut or you're doing definitely if you're doing hormones, maybe every 6 months would be okay. But from my point of view, it's pretty aggressive.
Okay, so if the person has done a few things and not aggressive, then 6 months would be a little too soon.
Probably for a repeat REMS is what you're talking about.
Exactly.
I think it's a little bit too soon, personally.
Okay.
Yeah, does that all make sense that, if you're going low and slow with all your treatment modalities, then it's going to take longer. And if you're a little more aggressive, then it might, definitely an aggressive response would be a lot of weight training and BHRT. So if somebody's doing that, absolutely 6 months.
Okay. Thank you.
Good to see you.
Okay, let me see. Let me go because I'm not gonna. Oh, I see what happened. Tony doesn't have her video on, so let me go to Tony. All right, Tony, you are on.
Thank you so much, Margie. My question is, we know a lot about the Onero centers and Dr. Sherry Betts's exercises, and the Onero is not anywhere near Anderson, South Carolina. My question to you both is, what are your thoughts on osteogenic loading, where they use a biodensity machine under supervision, and they really focus on just 1 or 2 repetitions of the heaviest weight, including a chest press, leg press, core pull, and vertical lift?
So, wait, I'll come on and talk about this. Hang on a second. Let me get myself on. I have to put my pin on. Where am I here? I have to put, okay, here we go. Okay. So I just have a question. By osteogenic loading, you're not talking about the machines. You're not talking about OsteoStrong. Is that correct? Or is that what you're?
I don't know of an OsteoStrong.
Okay, so you're talking about osteogenic loading just from, so you're saying chest press, what's the other one?
leg press, core pull, vertical lift.
Okay, so here's the thing. What moves the needle is, strength training. And it has to be at a certain level to, again, any strength training is good. And depending where you start, the bones respond to the forces placed upon it. So the Onero program was very effective and has shown, great results. But not everybody has a center near them. So how can you do, is that sort of your question? If you're doing these other things, is that effective? Is that your question?
Yes, and had you heard of that concept of osteogenic loading
Well,
of
osteogenic
the
load,
heaviest weights?
yeah, osteogenic, they're only doing one repetition. Is that what you're saying?
1 to 2 at your maximum output under supervision.
That's very, very, very high. I don't know anybody doing, the Onero that was so effective does 85% of one repetition maximum. So what that is 5 sets of 5 repetitions with weighting in between. I think it must be very, very heavy loads. I haven't seen any research on that in terms of such high loading. I think those exercises, the chest press, the on the machines, you're talking about the leg press.
Leg press.
That's a wonderful exercises. The exercises, in a neutral position are good but I think that's way too high. I don't know, I think the 5 sets of 5 repetitions, 7 are hard. That it's very hard, and people have really gained bone from that. But doing 1 to 2, maybe you'll gain bone, but to me, that's just an incredible force. So I have not seen research on that would say, yeah. So what I would do though, I don't think that's why I always like people to work with the physical therapist who's had a background. If you want to do something, if you want to find someone who's had a background in weight training and strength conditioning and all of that, and and work with them. But have you been doing that exercise, or are you just asking about it?
Well, I'm doing these exercises at the gym. I was only able to go to this clinic one time because it was 100 miles away.
Oh, yeah. So my suggestion is that seems to me very intense. I think the 5 sets of 5 at what's considered 85% one repetition maximum is hard. It's quite hard. So I don't see any reason to do higher than that. I just think that would be dangerous. So that's my thought. But you can do less. I mean, there is research, 8 to 10 repetitions, people have gained bone as well. So, yeah.
Okay, and I will end by just saying it's based on the book Osteogenic Loading by John Jaquish.
Oh, yes. So let me tell you about that. Okay.
Okay.
That is what OsteoStrong is based upon. That's what that whole principle is based upon. And where they do machines to really load. And what I will send with the replay is, I'm not going to go into it now, but I would like you to watch. They looked at things in terms of research based, and what they, in terms of, was this accurate research? Was this not accurate research? And so I will put in the bone clinic. I'm trying to think what they're called. Not Laura, Gian Gregorio from Canada, from Waterloo University, studies bone, and they found that this, yeah, so they were not happy with this program at all. But I will put the link in. I will put it with I will put it with the replay so that you'll see. Just watch this link, and it will go in much more detail. Okay.
Thank you so much, and I'm just so jealous that you have an Onero near you. But thank you.
Yeah, they're popping up all over, I have to tell you. And if not, work with someone who does the bone fit. You can still do this.
Sure.
You don't have to go to Onero. You can still take these concepts. Even the Sherry Betts program that I have is excellent. So anyway,
thank you.
You're welcome. Okay. Let's see. Let me know. I realized if I just go on the okay, so we did, I guess Jerry is next. Oh, do you have your video? Yeah, you do, Jerry. Okay, Jerry, you are on. Hang on, let me just get you all set. Okay, Jerry, you are on.
Hi.
Hello.
Can you hear me?
Yes, we can.
Great. Hi, ladies. So after doing Avinity for 1 year, after doing Avinity for 1 year,
Right, we have Canadians here.
I hear other people talking.
Yeah, I think we got it under control. Okay.
Oh, okay. After doing Avidity for 1 year, what are the options for the second year besides Prolia?
Definitely will. So it depends what you're after. There is some data where people are doing some anabolic stacking, where they're doing Evenity and Forteo and Timlos. I know that the really amazing response is Forteo or Timlos, followed by Evenity. If the so and whether it is rebound, then I think IV reclast is really one of the best options for rebound for Evenity.
Yeah, I just say I went to this, I was sat for days at the osteoporosis foundation, and that's exactly what they said, right? It's that the Evenity has had incredible results, followed by the reclass. And they follow you because they've even found for some people even one reclass every 5 years. So it's really interesting that it seems to stay in your system. And so, yeah.
Okay. So I built bone in the spine almost 19% from doing Avidity.
That's amazing.
Yeah, it
Yeah.
is.
Yeah,
And
I
I'm
hear,
also,
I hear 1890, anywhere between like kind of 15 to 19%. 19 is amazing, and then you see less in the hip.
yes, I'm also doing Onero. It's 5 minutes from my home.
Yeah, I mean, there's some data to show that the weight training plus the anabolics is even better than anabolics by itself.
Okay. How long do I wait after doing Avidity before I start the second plan?
The second what? You mean when you would
Yeah.
do IV
Reclass,
reclast?
Prolia, or
So Evenity is a once monthly injection, and so
did that.
you would expect to start to do the IV reclast well when the Evenity is wearing off, making sure to get a CTX and P1NP before, and then
Yeah.
3 months after reclassed, redoing CTX and P1NP.
Okay. Thank you very much.
You're welcome. Good to see you, Jerry.
Bye-bye.
Okay, let's see where we're at here. I think we have people. Okay, next. Oh, next is Kathy.
Hi, Margie.
Hi. We all know Kathy. Both
Nice to see
Kathy's
everybody. You've got a huge number of people on this call. It's remarkable, almost 500. Anyway, Dr.
Wait, Kathy, you got muted somehow.
I'm going to answer Lena's question because this is kind of a follow-up. How long on reclass after Evenity? I'm not exactly sure about this. This would be a Dr. McCormick question, but my understanding is that you want to be on some kind of a rebound medication for about 3 years after an anabolic. And one thing that Dr. McCormick says is that it's possibility that reclass can instead of it lasting a year, could last a year and a half. So you might only need 2 infusions of reclassed after Evenity.
Okay, I'm back. I got kicked off. Can you hear me?
Yep, you're on. Yep.
Okay, good. Okay, so Dr. Millman, what would you think if a patient's TSH in 1 year went from 3, which is normal, to 17?
Ooh.
Yeah.
Yeah. Okay, so one of the things that I think that would not be thought about, with most people is that iodine can cause TSH to rise despite the fact that the function of the thyroid has not been depressed. Because if people don't know, so TSH is thyroid stimulating hormone. it's indirectly related to the function of the thyroid. So 3 is TSH normal is something like 0.4 to 4.5. And the higher TSH goes, then it indicates a lower function of the thyroid. So when there's a jump of TSH from a 3 to a 17, that's a really substantial jump and indicating that potentially something is happening with the thyroid. So I would think about some kind of insult. I would think about one of the insults, if it's not iodine, where as people take high dose iodine, just the TSH receptors increase and TSH increases and is not really related to the thyroid function. I would be looking at, it's hard to look at these things, but one of the things that affects the thyroid almost the most is chronic viruses. And also I would say gut infections. And I would be worried that there's an actual thyroiditis. So what does that mean? It's inflammation of the thyroid. I would be worried that there was antibodies. I would be checking antibodies. I would be looking for potential autoimmune triggers. And it was something that was so dramatic like that.
Yeah, so like antibodies, the TPO is 16, so I guess that would categorize it as high.
Right, right. And so in my world, I'm thinking chronic viruses like herpes, CMV, gosh, why am I
latent
CMV, EMV, EBV, CMV, and herpes are the 3 biggest. And so I often will put my patients who have Hashimoto's on an herbal antiviral. So even as simple as some echinacea can actually be helpful. I use VIVI and stabilizer in my clinic from Systemic Formulas. Stabilizer tends to be more chronic viruses. I also do some homeopathics around it. That's really getting in the weeds, and I absolutely do a GI map and make sure that there hasn't been some kind of insult in the gut.
When you say insult, do you think a physical insult like parathyroid surgery could traumatize your thyroid?
Yeah, I saw that Kristen just asked that question. I don't know, Kathy. I don't know. I don't know that. Um, yeah, I don't know that.
Okay, I asked the surgeon and he said no, but I just, I'm not blaming him. I'm just trying to understand.
Yeah, of course, of course. I would just say that so I do a GI map, look for infections, look for any kind of overgrowth that looks abnormal, especially H. pylori, Pseudomonas. In the GI map, there is the inflammatory autoimmune section. You know what I'm talking about, right? So that's like Citrobacter, Klebsiella. You're seeing those kinds of bacteria that are emerging. They can cause an insult like that. And then you do a killing cycle and probably a longish killing cycle. And I would probably, start off with a 3 month of an antiviral.
Okay, thank you very much. I appreciate it.
Yeah, and you can call Lauren for stabilizer if you want to.
Stabilizer. Okay, thank you.
Okay, before we continue, there is an interesting question that because it relates so much. Let me just change the view for a second. Relates so much to what we just talked about, that someone's CTX is one, or if there was a person with a CTX of 1,100 after stopping Prolia, would you agree that reclass is the next step? So
yeah, so I did answer that in the chat, and
okay, great.
And so whenever CTX, so when you look at usually Prolia is the drug that will suppress the CTX the most. So, when you're looking at anti-resorptives, they're going to suppress the CTX. CTXs get suppressed by Prolia even more than IV reclassed. So the further the CTX gets suppressed, the worse the rebound will be. And the rebound will be that the CTX goes from something like 50 and it starts climbing. Anytime the CTX is above 350, there's bone loss. So 350, 400, 500, 1100 is pretty high CTX. In my clinic, this would need immediate attention, urgent attention. And again, I'm not prescribing bone medications, but from what I know, IV reclass would be the best thing to do. And if I had somebody in my restore and rebuild class and they were talking about something like this, I would have them contact Dr. McCormick as quickly as possible and tell Dr. McCormick's staff that Dr. Millman sent an extreme Prolia rebound to Dr. McCormick so he could help be on the case, because he's one of the best practitioners I know who really knows Prolia rebound. Wouldn't you agree, Margie?
Yes, I would agree. We both have sent so many people to Dr. McCormick because he has done this integrative approach. And he's the one that taught me where medications can be really, really helpful in an integrative approach and not forever. And he really knows this so well. And he does consults, and he's just a really wonderful person. And I'm sure there are people here who have seen him. Okay, Dorothy, you are up. Okay, so just unmute here.
Dr. McCormick is in Western Massachusetts, but he does consulting all over the country virtually.
Yeah, I'll put his information in the in when I send the replay.
Dr. McCormick does not prescribe.
But he's willing to work with your doctors, and he just helps people. He'll look at all your labs, really figure out the best course, because sometimes it's confusing.
Can you hear me now?
Yes.
Okay, great. I was trying to find my CTX and PA1NP course online. I broke my ankle on both sides 2.5 years ago, which got me really much more serious about doing something about my osteoporosis.
Can I coach you just a little bit?
Yep.
Okay, so instead of all the I's, could you say something like, if you had a person with this situation, or what would you do if a person had a bilateral ankle fracture with blah blah blah, and then have a direct question that you can ask, just so that it's not so blatant. You can do it.
I don't know can I tell you my CTX number?
Okay, so it sounds like you're asking a question about someone who's had a bilateral ankle fracture. So an ankle fracture on both ankles, and that you are wondering if a person like that with a CTX of approximately the following, what's the question? Are the bones stable? Are the bones not stable?
Yeah.
That's the question? Okay.
Yeah,
so CTX numbers
are in the 900s and
CTX
and now it's in the 500s. Is that in a good place to be?
Did you say CTX in the 900s?
It was after I had broken my ankle, and I did.
Okay, so here's the thing. Here's the thing, that CTX are always going to be elevated after a fracture of any type.
Yeah.
And it can be elevated for even up to a year. So it's really difficult to interpret a CTX after a fracture.
Okay. So does 500 sound like it would be too high 2.5
So,
years later?
so anything over 400 is losing bone.
Yeah.
So, not terrible, but losing bone, there's some kind of risk factor in there that is causing accelerated bone loss.
Yeah. So it's not getting better. So, with that in mind, I go to this bone builders exercise group, and if somebody has uh, an injury and it's sore after exercising, but it's not sore a lot, um, is that a bad, is it a sign to not do those exercises if there's any discomfort at all, or is some discomfort an okay thing when you're healing? When it
I guess that's probably a PT's question.
I came on. Okay. So here's the thing. I would see a physical therapist and really look at what's going on because sometimes, yes, as things are healing, there'll be a little discomfort, but it shouldn't last. It shouldn't be that you're exercising and it's increasing your pain and it's lasting. If it's a little bit of increased pain and then it goes away, it's short term. So it really depends. It's a huge depends answer. But I think, you've had an injury. I would, before I go to just a general exercise program, I'd have somebody look at it and really see what's going on so you can have a personalized exercise program. And that should be covered by insurance. There'd be no reason that that wouldn't. So
okay.
that's what I would do before you go just to your, a bone builders program that isn't specific for someone who's had a fracture of their
And
hip.
would they know about P1 and P and CTX scores? And
No.
I have to go to an MD for that.
I mean,
No.
really, that's not what you're asking a PT to do.
No, it doesn't matter.
What you're asking a PT to
Okay.
do is make sure that you stay safe while you're exercising, right? And that you're not causing more injuries. I wouldn't
Right.
expect the exercise class to be contributing to a high CTX or P. Yeah, actually, it's going to raise the P1 and P, but it's not going to cause accelerated bone loss because maybe, I don't know, maybe, you could probably think that it could increase the CTX a little bit, but that's not what you're asking the PT to do.
Yeah, I
Yeah.
would work with some
Okay.
type of practitioner or
Yeah.
take Dr. Millman's class. You'll learn all about this, but I think it's two separate things you're talking
Yeah.
about.
Yeah. Okay. Thank you.
Okay, you're welcome. Okay, let's see. Next we have, let's see here. We're gonna go to, okay, so next person. Okay, Yvonne, you are next. And are you gonna show your, are you showing your screen or not?
I will.
Okay, great. Okay, so I will, I will put you on. Hang on. Okay. Okay. Wait, where did you go? I saw you up here. You want to show your screen and then I'll just put you on for everybody?
Song.
Yeah, I see you.
You see it?
Hi,
That's so cool. Maybe I'm on, oh, I see. I'm on a different screen now. Hang on. Wait, that's so strange. I don't see. Oh, there you are. Okay. I
Oh, Marty's here.
okay, Yvonne, you are on.
Okay.
With Dr. Millman and I know a lot of people, so we're always excited to see everybody. Okay.
About the Restore and Rebuild course. I'm wondering if it's offered every year in case I can't take it this year. And I'm assuming that we have lifetime access if we take it.
Yeah, so it's offered twice a year. And once you join, then you have lifetime access to the materials in its current state. You don't have access to the updates. And if you if you join once, then you can also do the alumni in subsequent cohorts, and then you'll get the updates with the alumni.
Okay, and how much would the alumni cost?
Alumni is $247.
Okay. Yeah, I know that with the test and everything, if I don't have not working with an integrative doctor, how do I get the tests and order them, and how do I interpret them correctly?
Right. So I give you resources as far as how you can, the tests that you would be wanting to ask your doctors for. And then if your doctors refuse to do the testing, then there are ways to order them on your own. It's a little bit more costly. A lot of the tests should be covered by insurance. And if your doctor doesn't want to do it, then obviously, if you did it out of pocket, it would be more expensive for you. And I teach interpretation in the class, and we also do a lot of we do Q&As for, it's a 14-week class, and there are 10 live Q&As. So there's a lot of time in order to ask questions, and we try to generalize the questions, but people can pre-submit questions, and then we have live questions as well. There's ample time to get your questions answered.
But don't I need to order them through a practitioner?
Well, so what I'm saying is that the best case scenario is that you take the list of what I'm recommending to get ordered to your doctor and have your doctor order it for you. And I have test codes and all the information about what are the essential bone labs. And then, but if your doctor won't do that because they don't know how to interpret a CTX, etc., then there is a way to do it on your own where it's out of pocket. There are direct-to-consumer lab companies that you can do it. And I give you the resources to be able to do that. That also is the case for functional medicine labs as well.
All right. Is when out of pocket, is that kind of exorbitant or $5,000 for one test?
Oh,
Or
no, 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 no. No, I would say that kind of your basic labs, if you had to do everything out of pocket, would be, I would say the CTX and the P1NP are the most expensive, and they're about 150. And basically it would be maybe 500 for the the blood and the urine tests, functional medicine tests. There's three of them, that the three big ones that I recommend, and those three big ones, even out of pocket, is 1,500. So you're looking maybe 2,100 to do everything, just about everything.
okay, because I was thinking, no point taking it if I won't be able to afford the out-of-pocket expenses. And also if it wasn't like some people just offer the courses and you have 3 months to look at it and you don't have lifetime access. It's kind of hard to drink everything in. So, okay.
Yeah,
So,
you have lifetime access, and I mean, I find that a lot of the doctors do. I mean, doctors are going to do some of the basics, and you may have them already done from just a physical. So a comprehensive metabolic panel, a CBC, a lipid panel. So, the doctor should be doing a parathyroid. They should be doing a 24-hour urine calcium. So these are not like, really exotic tests.
and how, you said you offer it twice a year, once in August, and when's the other time of the year?
I think we usually do it in March.
Okay, how would I know? Call your office or?
I'm coordinating with Margie all the time about and she about but when it's offered, and she usually sends out emails to her community letting people know. But it's August and March.
Yeah, I'll let you know. There's no problem. Don't worry. We won't, we'll tell you.
Thank you very much.
Okay, you're so welcome. Okay, next person does not have the video on Catherine. Catherine, are you there? Let's see.
Can you hear me now?
Yes, we hear you.
Okay, very good. Hello, Dr. Millman. Whoops, there we go. My question is, I'm wondering about calcium calcification in the arteries for those who have osteoporosis, if that should be checked, and about a high 24-hour calcium urine test, what that ramifications are.
Okay, so what is specifically your question about calcifications in the arteries?
Well, I had read some articles about the fact that osteoporosis, if you have been diagnosed, can give you the, I should say, the predisposition or whatever for higher calcium calcification in the arteries.
So I think what you're
So I'm
talking
asking,
about,
is that true, or should you have further testing
I think what
in
you're
that realm?
talking about, I think what you're talking about is the calcium paradox, which is, how can you have a lack of calcium in in the bones, and yet a more extensive calcification in the arteries, causing um, calcium plaque in the arteries and causing atherosclerosis, right? So one of the issues is that, vitamin K and magnesium and vitamin D are all really central to this process. So you have vitamin K helps to take the calcium that is in the arteries and bring it to the bone and not allow the calcium to be deposited in the arteries. And so in bone disease and in heart disease, there can be vitamin K deficiencies. And so you also have the same issue with magnesium. So there are many, many shared risk factors between the bones and heart disease. And I don't know if you still have access to it, but I did a really comprehensive review of the relationship between um, heart disease and bone loss. And that was in one of Margie's summits. It might have been this last summit, Margie, I think. So it's a pretty long and an involved process, but there are shared risk factors so that you can have, if you have vitamin K is like the big driver though. So that's one reason. Another reason to make sure that your vitamin K status is sufficient, and be taking some vitamin K if you're not eating enough vitamin K rich foods. And I think taking vitamin K supplements for both is a good insurance policy. A 24-hour calcium that is high can be from high bone turnover, can be from hyperparathyroidism, and probably the biggest driver of high 24-hour urine calcium is metabolic acidosis. Metabolic acidosis is a condition in which it could be caused by a lot of different things, but basically the body is too acidic. And that then drives the calcium to be lost through the kidneys. And so some of the things that can cause metabolic acidosis include toxicity and inflammation, and again, too high amounts of calcium. And one of the big ways to help with metabolic acidosis is to alkalinize the diet. And one of the big ways is to have enough potassium. So I think those are kind of some nuggets. Was that helpful?
Yes, 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 yes. What did you
It
say?
is
Alkaline diet?
an alkaline diet, which would be, high amounts of vegetables and sufficient amount of protein, but not too much, not too much grains, not too much high intensity exercise, reducing stress. So a lot of those lifestyle issues as well.
Okay. Okay.
Okay. Next person is Dylan. And I don't think video's on, but Dylan, you're next.
Hi. Thank you, Dr. Millman, Dr. Bessinger. This has been very helpful. I'm a newbie to this world. I am 53 years old and was just diagnosed with osteoporosis. My OBGYN decided to do a DEXA score on me, and it came back pretty high with osteoporosis. And I am okay, what would a person who is dairy-free do to increase their calcium intake? What type of supplement and how much of said supplement would be beneficial? Also, what type of exercise would be beneficial? Personally, I've been doing Pilates for 12 years, but based on this whole, forum, I'm feeling that maybe I should be doing something a little bit more hardcore rather than reformer-based Pilates. So any insight on either of these things?
Yeah, so I would say that the calcium question is a little bit more complicated than you might expect. So because of the calcium paradox, and because of the fact that too much calcium from food and supplements have been related to higher rates of heart attacks and strokes, and because of that vascular calcification, my recommendation for total amounts of calcium to get through the food and the supplements is 800 to 1,000. And this is based on a full review of the research, especially that research that relates to calcium supplementation and heart attack and stroke risk. So that being said, I think it's very important then for a person to customize how much supplementation they get. And I recommend a free app called Chronometer. And you go on to Chronometer, you put in your dietary, your food into Chronometer, and then you find out how much calcium you're getting. And then I have people take 1,000, 800 to 1,000, subtract off what they're getting from food, and that's what they would need from supplements. I recommend supplemental calcium in the form that is most related to food, most like food, which are the calcium chelates. So these are modified amino acids that are chelated to calcium that make it absorb in the best way possible. I like calcium dimalate, and I am a big fan of I recommend Designs for Health, calcium 2 to 1, so that way you get calcium dimalate and magnesium dimalate, and you want to have magnesium at least half of the amount of calcium or even greater than that. And I'm really a big fan of Designs for Health has something called OsteoBen. OsteoBen has 400 milligrams of calcium dimalate, 400 milligrams of magnesium dimalate, some zinc. I think 1,000 I use of D. I think it's 7 or 8 milligrams of zinc, which really also helps with absorption, and it's got genistein in it. And genistein has been shown to decrease CTX and increase DEXA scans at the 2-year point. So Osteomen would be my first choice of somebody to kind of start with. And for sure, calcium can be, even if you think about calcium supplementation as being pretty safe, but it gets really complicated when we're talking about a person who has hyperparathyroidism or, a high 24-hour urine calcium, or then things need to be more finessed. And that's another reason why these things really need to be tested, the calcium, PTH, vitamin D, all at the same time, 24-hour urine calcium, all at the same time, really see how the system is working. So, yeah, but that's just kind of the basics on calcium. And then as far as the exercise question, I think that is probably a Margie question.
Yeah,
I don't know, Margie, if you think that that's a good enough question to answer, or because
Well, I'll answer
it's
it real quick.
basically, okay.
A really good question to answer. So the truth is, bones respond to forces placed upon them. So Pilates with a reformer, when you're using the weights and you're using resistance, I have had patients over the years, that's the only exercise they've done twice a week who have gained bone density. So it's certainly okay, but I think you could take it another level. What we want to do what we know works. And the hip is such an important area that we found that squatting and being in when you flex the hip, that's what they found in those functional positions or where it really gained bone in the hip. It's really important. So I think if you can find also the strength training, and combine that with the Pilates, I think that would even take it to another level. So I think especially you're young, and there's another level you can take that we even know gains more, that's been so effective in increasing bone density. So if you can do that, I would stick with the Pilates. Certainly nothing wrong with it. There are positions to avoid, rounding postures. So you do need to modify the Pilates a little bit. I'll put in the chat actually safe Pilates. I'll put a link for you. But yeah, I would continue that. That's good. And I would add a little more with the strength training.
Okay, thank you so much, both of you.
Oh, you're welcome. Okay, so let me get back to the order here. Okay, so I think the next person is, I think this is the right order. Do you see it also, Dr. Millman? Is Jeanette the next person? Is that how you see it too?
I have a totally different order than you do.
Or is it Ruth? There's like two
I
ways.
see Ruth being.
Okay. So let's go to Ruth.
And then I also see like Diane Lucchesi has been up there forever.
Okay, so I have Ruth, iPhone, then Diane. That's sort of how. Does that your order too? Usually it shows me everybody in order. Do you have that as well?
I have Ruth, iPhone, Diane, but I know that Diane's been in that third.
Okay, well, we'll get
sitting there. You got to get Diane off the
All right.
board.
All right, we'll get Diane. All right. So Diane, where are you? You can come on, Diane. But Ruth, we're getting to you too.
Okay.
All right, Diane, I see Diane. We'll get to all
Hi.
of you. Okay, Diane.
First of
you're
all,
on.
thank you both so much. I've heard you both a number of times and I've just learned so much and I love you both. My question is something that's a brand new thing that's out there. It just got FDA approved and that's called Osteo Boost. It's a belt you wear and it's the same principle as vibration plate therapy, except it's, targeted specifically to lumbar. And I read everything I possibly could. And I know that all the clinical trials dealt with women around 62 years old who are osteopenic. But I can't get any information about whether this could be either helpful or harmful to people maybe who might have osteoporosis in the lumbar, but not in the hip, and who might be older than 62. And I don't know if it could be effective, but also the vibration, could it cause harm if your lumbar, let's say, has reached over negative 2.5? And that information doesn't seem to be anywhere. And the doctor that told me this exists doesn't know the answer. And I went to the OsteoBoost website. Can you speak to that? And thank you right now for your answer.
Dr. Millman, I know the answer to this very well. Okay. It's really sad, actually. I mean, to be totally honest, it's really sad because the research on this, and there was an article published, they used a lot, what they found in the research, they didn't, first of all, it's meant for osteopenia, that's the indication. Has never been shown to increase any bone. It's just they say it reduces the loss of bone. But if you look at the research, and there's an article that really examined the research, it wasn't that they found improvements in DEXA scores. It wasn't that they found any improvements. One vertebrae, L1, they showed less of a loss. So the results really are not good for the research. And there were people that had to stop it because they had back pain. And so really the research isn't good. It's sort of like you don't have great research and then you find one thing maybe. So it's hard to, so I'm not a proponent of it because I don't feel it's in a weird position as well. And the research just really doesn't support it. So I haven't, so I do have the article and I'll send that with the replay that you can read where they, really said what kind of research is this in terms of, I'm a big believer in vibration. I absolutely love the Maradyne low intensity of vibration because it barely feel it. And they've shown that those parameters of the parameters of which is low intensity vibration is effective for stimulating what's called the mesenchymal stem cells. And that's in the bone marrow to turn into bone instead of fat. So anyway, I could go on and on, but basically I do not recommend that. The research, and I'll put something with it, is not what they, it was approved, but people wrote back like, what are you doing? Because the research isn't really very helpful. So if you want to do vibration, I think the low intensity vibration is good. It's safe for everybody. And I think that really doesn't have the research to back it up. I'd rather do exercise.
Okay, and osteoporosis in one area and not osteoporosis, let's say in your hip and femoral neck. Is that osteoporosis then? That's not even clear, but all right, I shouldn't ask anymore.
You want to answer that, Dr. Millman?
Well, yeah, I mean, that is very clear because you have to talk about each location separately, right? So you might have osteoporosis in the lumbar area and you might have osteopenia in the hip, and that you just have to talk a little bit more in a more detailed fashion. But really, your diagnosis of osteoporosis and osteopenia is based on the worst of the areas. So if you have one area that has osteoporosis, you have osteoporosis.
Thank you. You're awesome.
Hey, thank you. Well, Ruth, you're next. Okay, let's get to Ruth here.
Hi, thank you, ladies. This is great. I'm a certified practitioner, but I know just enough to be dangerous, so I'm grateful for everything I learn. Okay, let's say, a friend of mine has slight osteopenia in her femoral neck and is waiting to get her next DEXA. I don't know why it's in this 70s. She's 74, and then you have to wait 2 years to get your next DEXA. But so her CTX in January was 28.5, and the P1NP was, 285, and the P1AP was 28.3, so not too bad, I guess. But
based on the criteria of 250 to 350, isn't it optimal?
It sounds good.
Yeah, it's optimal.
But she's lost some weight and she's down to 90 pounds. So she's concerned about that because I don't think that's good for bones, but she's doing a lot of resistance training. And I think the DEXAs don't look really good when you're so skinny. But anyway, she's just concerned about taking the right supplements. And there's so much controversy around which K, the K1, the MK4, the MK7. Is there a supplement you recommend? Her vitamin D is really high, so it's like 95. So I don't think she should be taking any more vitamin D or in minimal amounts at the most. You know, she lives in the desert, so she goes out early morning and walks and sunset. So she gets her sun. So, like, I don't know what the best way to support her.
Yeah, so I can respond to a few of the, I can
Okay.
there's a kind of a lot to unpack in that, right? Um, so as far as a person's bone frame size, as and there is potentially a artifactual decrease in that you'll see in a DEXA when a person has a small bone frame size. So I'm pretty average, and when you look at what a T-score is, it's basically a bell curve of all the population, the bone density scores in, I think it's grams per centimeter squared of bone mineral content, and that's plotted over a bell curve. And when you look at the median and you start going to the right, which is bone loss, you look at standard deviations from the mean. And so the T-score is this number of standard deviations from the mean compared to a 35-year-old woman. These are not standardized to a person's bone frame. So you're getting compared if, let's just assume that you have a small bone frame, and typically it has to do more with height and the frame size than the actual weight of the person. The weight of the person is going to, if it's low, is going to encourage bone loss because, like Margie said, there's not as much loading force from carrying the weight around. So and there's this study, I think it was Alvarenga, which showed when they looked at TBSs that about 30% of women who had an osteoporotic T-score actually had a TBS that was normal. So there's that situation, and that is just part of the limitations of the DEXA scans. I think that that's probably as far as I can take it without really going into the weeds of how that can more limitations of the DEXA scans, and there just are. I mean, we don't have, we never have perfect technology, but TBS is really helping us in establishing quality, and that's really been, yeah, I think a big step forward in being able to look at this. As far as vitamin K, I've done a lot of research as to what forms of vitamin K have the best fracture reduction. And from my research, it's vitamin K2, which is the best research is on MK4. And MK7 is kind of lagging behind, but there's some pretty good data on MK7. And then I did a big deep dive this last year in vascular calcifications and what type of vitamin K may reverse it. The data is mixed. We don't know that vitamin K does. In some studies, there's some reversals of calcifications in the arteries, but it's not conclusive. The data on vascular calcifications has never been done on MK4, only K1 and K7. So what I'm recommending in Restore and Rebuild and to my own patients is to kind of hedge your bets and do a little bit of each one of them. And the really exceptional thing is that vitamin K has an excellent safety profile. In these studies, there were no excesses of heart attacks or strokes. There was no blood clotting that was seen, but this was done in a population who didn't have any blood clotting issues. And so my recommendation is to take Thorne vitamin K and to do 2 a day. And that gives you vitamin K1 at, I think it's 1 milligram in 1 capsule. So 2 a day, you get 2 milligrams. And the data on vascular calcifications was between 1 and 10. And so then MK4, it has 5 milligrams of MK4. The data was done on 15, but there is some data to show that anything over 5 doesn't mechanistically produce what's called more carboxylation, which is the carboxylation that pulls the calcium out of the arteries and goes to the bone. So 5 milligrams twice a day of MK4, and then it has 180 micrograms of MK7. So double that, that's 320. And the vascular calcification studies have been done anywhere from 100 and might be all the way down from 90 micrograms to 720 micrograms. So that's kind of where I settled on, was to do 2 a day of Thorne vitamin K. That covers your bases. It helps you potentially with vascular calcifications, and it also helps you reduce fracture risk.
You take like one with breakfast and one with lunch, or you take them at the same time?
No, because of the fact that vitamin K has like a 3.5 hour half-life, I recommend at least it being separated by at least 3.5 hours. So I do one in the morning, one at night.
Okay, yeah, because K4 has the really short half-life. And
Exactly.
I love Thorne and Designs for Health, and they're two of my
Mhm.
Okay.
So we'll have to move on, but thank you for
Thank
your
you so much.
question. Yes, you're welcome.
Okay, next person is an iPhone. I don't know who it is.
iPhone 5.
So if you know who your iPhone is, it might say K. I'm not sure who this is, but you can, if you've been actually I can ask you to.
Maybe it's me. I don't have a video. It's Seema.
Okay, I asked you just to unmute. So did that come up to you? I guess that's you.
Did I unmute?
Yes, you unmuted. Okay, great. So
Okay, sorry about no
Oh,
lack of video, but the question is for someone who it's not actually a bone fracture, but a person with osteoporosis, pretty stable, had one wrist fracture quite a few years ago, otherwise stable, very small frame, and probably what Dr. Millman was talking about in terms of standard deviations and being averages. So I don't know to what degree the osteoporosis is a factor, but the person is also has hypothyroidism, and the current problem with that person is that a foot injury, where initially was diagnosed as tendinitis, then it was said that there's some fibers and ligaments are torn, and the bone in the ankle, on the inside of the ankle, is sticking out, and very painful, and it's been over a year, and not healing. So the question is, any recommendations in that situation? Any supplements, therapies, weight training, whatever? The physio are not really helping much. A sports medicine told that person to just put up with it for the rest of their life. The person is
So I'm
$75.
not completely clear, but what I think you're asking is, do we have any recommendations for how to heal a sports injury more
It's not a
quickly?
sports injury. The person is 75 years old, and it happened just
So
normal.
an injury that involves the ligaments?
it seems that that's what they now saying, that these are ligaments, but the swelling is in the arch on the foot and the bone on that is directly above the arch on the ankle, and the pain there.
So I often use an herb called Gotu Kola, Gotukola, for healing kind of any tissue. I like the Medi herb from standard process is Medi herb Gotu Kola. I'll put it in the chat. And then anything that would help with inflammation. So I would be thinking about high dose curcumin. I would be definitely thinking about PEMF.
Yeah, the person is doing PMF daily with the high dose mat, grounding, high protein intake,
Protein, right?
homeopathy, you name it.
Yeah, I think like any more detailed than that, it's probably just not going to be relevant to the rest of the group. So
I see, but Gotu Kola for I don't know if it has anything to do with bone, because the pain is around the bone, and whether
Gotu Kola is a supplement, an herb that helps with all tissue healing. I use it for healing bones, healing ligaments, and of course, I would recommend that to my own patients who I knew their medical history. So, of course, this isn't medical advice to you, but
no, of course not. But general Gotu Kola as a tincture.
I use Gotu Kola from Medi Herb, and it's a tablet.
Okay. Okay. Thank you so much. That's been very helpful.
You're welcome.
Okay, let's see where we are here. The next person, who do you see as next? Do you have Denise? Is it Denise? Yeah, Denise, you're on. Denise, are you here?
Hi.
Hi, let's see where you are.
Hi, I'm on. I think I'm on. Am I on?
Is your video on too?
No, my video's not
Okay.
on.
That's fine. No problem.
I had heard, and I want to thank you for being so brilliant and following up and getting Dr. Millman on and all you do, Margie. And thank you, Dr. Millman. My question is going to be pretty, I think, simple overall, because I'm pretty new to all this and overwhelmed by most of what I do. I'm going to have to learn the language you guys are speaking.
There's definitely a language.
There definitely is. So I heard that Thorn K is that you highly recommend it, but could you recommend just another? I have a bit of osteoporosis and osteopenia in my hip area. So if you could just recommend a couple of basic vitamins, it's a starting point, and I'll listen to all of this.
Yeah, so I think that if you heard my discussion on calcium, so people should be taking 800, so people should be getting 800 to 1,000 milligrams of calcium in the closest form to food as possible, including 800 to 1,000 includes their food. So doing a dietary assessment with something like chronometer. And then for magnesium, half as much calcium would be for magnesium, all the way up to, I mean, you really can load with magnesium, and some people need much more magnesium. So magnesium, even if you were taking, if somebody was taking 350 milligrams, just as an example, 300 milligrams of calcium, then magnesium could be anywhere from 150 to 600 to even 1,200 milligrams of magnesium. Magnesium I like in the L-threonate, which is it crosses the blood-brain barrier, and that's very good for anxiety and sleep and taking that at night. And then I like magnesium glycinate for kind of general magnesium. Then I like magnesium citrate for having the most bowel um, bowel moving properties. And then, so you got calcium, magnesium, you want vitamin D. And somebody mentioned that vitamin D in the 90s is not a good idea. I do not like vitamin D levels anywhere over 80 because vitamin D brings calcium from the gut and from the bone into the blood. So you're trying to, so vitamin D is going to pull too much calcium out of the bone at higher levels. So I'm recommending levels to not be any more than 80, but vitamin D intake requirements are related to how light your skin is, how much sun exposure you get, what your weight is, and obviously the season of the year. So vitamin D intakes are going to change. And then vitamin K, like I said, I like Thorne vitamin K, but you can get that if you don't have access to. I mean, quite frankly, I would tell you that if you to maybe sign up for Margie's full script account, and then you would have access to the Thorne vitamin K.
Oh, that'd be great. Yeah. Thank you.
Yeah, maybe Margie can send out an email. I don't know. She offers people to sign up to her full script account all the time. So, and then now you got vitamin D, vitamin K, calcium, magnesium. Now you start getting absolutely protein. I like Perfect Amino for proteins. The important thing about that supplement is that it's a collection of amino acids that actually build protein better than food itself.
Wow.
So that's, it's because the bottleneck amino acids that you need in food, like those amino acids you don't get very often in food, are in highest amount in Perfect Amino and build protein. And so those are your basics, but then, you need to have enough iron, you need to have enough zinc, you need to make sure that your homocysteine levels are not too high. So you need B vitamins and you just have to have like basic nutrition. You need to be feeding your bones the nutrition it needs. And so just sort of the basic nutrients need to be covered.
I'll reach out to
Yeah.
Margie and
Yeah.
Margie and see if there's like a book, like almost like a beginner's book. Or you guys need to write a beginner's book.
Well, it's just,
We could write a beginner's book.
No overwhelm. You do
Oh,
one thing at a time. So don't get overwhelmed with everything. That's number one. Number two, there is a lot of information and it's just not so simple. We wish it was like boom. That's why Dr. Millman's course is how many weeks? It's 10 weeks, right? In terms of, there's just a lot of information to gradually absorb, but she gave you the basics. But yeah, that was yes, but don't get overwhelmed. It's just
Thank
not
you.
overwhelmed.
Thank you both so much.
Okay, I guess let's see. Kathleen, are we up to Kathleen? I think we're up to Kathleen. Okay, Kathleen, you're on. Unmute.
Yeah. I was just wondering about vitamin K, the literature on vitamin K, and because I was on another bone group and they said that there was still a lot of controversy about whether to take vitamin K, etc. But you pretty much answered that question already. So
I don't think there's controversy about whether to take vitamin K. I think there's controversy about which vitamin K to take and how much.
Oh, okay. So could you just repeat what you said? Because I've been taking 45 milligrams of MK4 a day, and then I think
So
it's
I think
okay,
that
60 micrograms.
so 45 milligrams altogether isn't going to be any better than 5 milligrams. And so, there's data to show that the big Japanese studies were done with 15 milligrams 3 times a day for pharmaceutical doses of MK4. and they showed a huge reduction in fracture risk. And so that's the MK4 dose is based on that. But there's some literature to show that the mechanism by which MK4 helps to take calcium and put it into the bones and get it out of the arteries is through this mechanism called carboxylation. There's some data to show that anything more than 5 milligrams of MK4 doesn't carboxylate these proteins any better than more. So what I'm saying is that, and none of the vascular calcification data has been done on MK4. Doesn't mean that MK4 doesn't work. It's just all the data is on MK7 and vitamin K1. So Thorne vitamin K has a mixture of K1, MK4, and MK7. It has MK4 in 5 milligrams, which I love, right? Because that's kind of the golden number for me. And so you take it twice a day, you're getting MK4 in just the right amount, not quite according to its half-life. It would be nice to take it 3 times a day. But I think you're hedging your bets because you've got K1 where it's within that vascular calcification range. The studies that have been done, the doses are in that range. And MK7, the same thing. MK7 has a much longer half-life. So between the 3 of them, I believe that that's the best solution based on the data that we have today, that vitamin K is going to do both, which is protect you against fractures and protect you against coronary calcifications.
Okay, thank you very much.
I know that was complicated, so I mean, I hope that going through it the second time helped.
So just to make sure I understand, so 5 milligrams a day of MK4 is probably enough?
I would do 5 milligrams twice a day.
Okay.
And if you're only relying on MK4, I would do it 3 times a day. And there's nothing wrong with taking 15 milligrams 3 times a day. That I recommended that for 12 years.
Okay. Because that's what I've been doing. Okay. All right. Thanks very much.
Dr. Millman, who do you see in order? I'm just making sure my order is correct. Who do you see as next?
I think Deborah has been up there forever.
Okay. It's interesting. I have a different order, but okay, Deborah. Usually it shows me the exact order. Okay. Deborah. Yes, now Deborah is up. Okay, Deborah,
Okay,
you are on.
okay. I have been up here quite a while, so thank you very much.
Yes, unfortunately.
And I appreciate all the helpful information. And I just wanted to share about a person that I know who went through years of Lyme disease and lots of different things that affected probably bone loss. So at 65, she got her bone density scan done. That was in 22, and it was negative 3.8. And she did not want to go on drugs right away until she had a chance to find out how she could be helped by other things. So she looked into, she's doing the hormone replacement with creams with Dr. Michelle Sands, and started the change in her diet and a lot of things. The main thing she did not do as much of, because of kind of being bedridden on and off, was doing the weight bearing. So she had a retest done in last year in October of 24. So it was about 15 months from the minus 3.8 in the lumbar, and it was minus 3.4 in her femur. And she ended up gaining just a tiny hair. In the lumbar, it went from the 3.8 to 3.7. And then on the femur, it was minus 3.4. It went to minus 3.2. So she's moved to another state now, is getting ready to do another bone density scan with a new doctor. And so my question is, what would be the best thing for me to ask my doctor to run according to these things. Do I need to do the CTX since I actually didn't lose any bone? I gained a tiny bit. Just didn't know what you could respond to some of what happened.
Yeah, so there is a 2 to 3% is an amount that is considered to be within the error rate. So through, just a point is likely to be within that error rate. However, even the amount that the natural history of bone loss is for you to lose every year, especially if you're postmenopausal. So even staying the same, and I would say within 2% is basically staying the same because it's within the error rate. Even staying the same is an improvement because and I see all the time that the BHRT helps to improve bone. So a CTX would still be helpful. And I teach in Restore and Rebuild, and to my patients that there's a certain target level at which the estradiol level, testosterone, and progesterone should all be for the best bone supporting efficacy, and that you should see that low estrogen is going to be reflected in high CTX. And so you should see that when you get to the bone target optimal level, you should see that reflected in CTX. So CTX would still be an appropriate marker to look at along with the serum levels of the hormones and DHEA.
So this person gets her hormones tested through saliva. And so would that still be okay? And if you don't get the serum levels?
So all the bone supporting targets and the safety measure for targets are based on serum.
Okay.
I also look at the Dutch test, which is it's not 24 hour, it's a dried urine test, and it actually replicates a 24-hour urine test and 24-hour hormone levels better than serum does. But the bone targets are really based on serum. So, and again, not every practitioner knows those targets, and those targets are complicated and they're different for different groups of people. So I don't want to go into those and like confuse people.
Right. Right. So this person, it would be good if she at least asked for the CTX, but she wouldn't necessarily need to ask about the P1NP.
I get both. But if somebody has to choose one, I would always, go with the CTX more. And the reason why I say this is because there are many more root cause factors that break down bone than root cause factors that build bone. So building bone is more like the nutrition, the protein, collagen, your calcium, magnesium, B vitamins, and exercise. And then most everything else, well, progesterone and testosterone are bone building hormones, estrogen, high cortisol, high thyroid, all that stuff is bone, that's all bone breakdown. So there are many more root cause factors that are affecting bone breakdown. So if I had to pick one or the other, I would definitely be picking CTX, and that is directly related to estrogen levels. And so, even if that practitioner didn't know the bone targets, then and that's like one reason, like to take Restore and Rebuild too, is that you get educated enough on your own to understand that kind of thing. And but the CTX should come down. I've seen the CTX and many times go from 600 to 300 just by adding BHRT, and even the estradiol is not even as high as I'd like it to get, but it still brings the CTX way down.
Okay, okay. And since this person's been on it since 2022, fall of 2022, it could be that the CTX might be in a good range, possibly. I don't know.
It absolutely could be.
Because it didn't lose any mass. So the other part of the regimen she had with her vitamin D recently tested was at 52. Is that an okay?
52 is a great range for me. So I like 50 to 80.
Okay.
But I think we're going to need to move on.
Okay. Thank you very much.
You're welcome.
All right, so it's now it's now 7:53. I promised Dr. Millman we were not going more than 2 hours. Do you want to share just a few things for people? I mean,
about the course, about restore and rebuild.
Course, and then I
Yeah.
know, a couple. I don't know how long you wanted to stay. I know we said we said we're not staying more than 2 hours, but yeah.
Do you know what time we started? We started
Yeah.
a little bit after 3, right?
Well, yeah. So we start. So it's almost been 2 hours, but I do want you to talk about the course for a minute. But
yeah. So
people have the hands up. I mean, but we've been going 2 hours.
So couple of people have said, one person was saying, it's kind of like it's really a new language that you're learning when you start, going through these medical terms and the testing. And I mean, I think that what Margie and I have both found was that there just aren't enough practitioners who like, I think that when we were talking about the bone targets for estradiol, I think that that's one of the areas where I really researched to figure this out. And so I would say that many practitioners, while they are good in hormone prescribing, they still don't know these bone specific testing targets, and they also don't know how they relate to CTX. So because of the fact that there just aren't enough practitioners available, that's one of the reasons why Margie just urged me to develop Restore and Rebuild, and we co-teach it. And so, I invite anyone who hasn't, really wants to be proactive, take control of their health, and, really understand these concepts. And what I'll say is, even if you're a beginner or a novice, I still think it could be helpful because of the fact that you have this long access to it. So I have people who have gone through once and kind of not really felt comfortable enough about doing any testing for that first cohort. They come into the alumni, they still want to stay in the community, and they still want to have access to the Q&As. So they take the alumni, then they start doing a little bit of testing, and then they gather more knowledge and they go through it again. They go through the information again, and I'm constantly updating as well. So even if you're a novice, I think that Restore and Rebuild is really empowering, and it's also just you may learn things that your practitioners don't even know. And so then you can do like I said, you can do the testing on your own. And you can also just keep looking for a practitioner who would even be interested in learning some of these targets. And my materials are based on research. I give articles all the time in Restore and Rebuild, and you could bring an article to one of your practitioners. So, that's what I would say about Restore and Rebuild. It also, I think, can be money saving because if you come into my clinic, my initial consult is $600. Every follow-up is $300. And so just in one consult, with Margie's discount, make sure to use her coupon. You can just, it would be one consult in my office, the amount of tuition. And like I said, you just, if you have to go slow, you have to go slow. So I think I know there are a ton of people who are in the community who are actually here tonight, who have taken Restore and Rebuild. I'm not sure that we really have time for people to come on. I don't know, Margie, if we do.
And we can go, I'm fine with going a little longer. I don't have it.
So I don't know if anyone wants to come on. Kathy's here, Kristen's here, Richard's here. Richard's been like answering all kinds of stuff in the chat. So I didn't teach Richard all that stuff.
Marty's here. Let's see who else. Hi, Marty. Marty's from Australia. Someone had asked.
Marty's here.
Let's see who else.
Oh, Rosalind. Oh, Rosalind. Rosalind, you know what Rosalind told me? Can I say this, Rosalind?
Where is Rosalind? I don't see her.
I don't know. She just typed in the chat.
There's Marty.
All right, Rosalind can get mad at me. She already told me that I can say that. She said that it was the best course, I was the best teacher, and I was the best doctor. Remember, Rosalind? You said that. We really got so many nice comments and testimonials always, because there's Joni. Joni, do you want to come on? Anybody want to come on?
I put Marty on.
Yeah, this is.
Marty on. I saw Marty.
There's Rosalind.
Yeah, sorry, I'm on my iPhone, so a little tricky. Yeah, no, it was an amazing class, and I'm still, going through all the notes and everything. And I can't do the alumni this time, but I probably will in the future. And just thank you for everything. And I appreciate too, just whenever I ask a question, I always get a reply, and just your breadth of knowledge and just your whole demeanor, everything. It's just amazing. So thank you.
Yeah, thanks so much, Rosalind.
I can say something. I've taken Dr. Millman's class 4 times. I'm thinking of taking it a 5th time. It is beyond amazing. I learn something every single time. She updates all the material and answers all our questions and is super supportive. And I've gotten my conventional doctors to work with me with the information that I bring to them. It's worth every penny. And you make good friends in the class.
Yeah. Thanks, Kathy.
Can I?
There's Marty.
Oh, Marty's there too. I'll let Marty go.
Yeah.
It's 10 o'clock in the morning, huh, Marty?
Yes, it is. And I haven't asked my question yet.
Uh-oh.
Look, what Katie just said, I wholeheartedly agree with all that she said. I've learned so much, and luckily I have a doctor who I go to him and I tell him I want to do these tests, this, and he'll just write them down for me. And he even asked me, what are you doing for your, and he's also sent a couple of his patients to me with osteoporosis, so so I could help them. So yeah, no, I've learned so much, and I've taken the course 3 times so far. I won't be doing this one, but I'll probably let you on again next year, I'd say, for one more course, because I always like to ask questions, and the community is great. And yeah, no, I recommend it to anyone. It's a good course. Lots of information, lots of everything, and yeah, I have learned a lot. So.
Thank you so much. Yeah, I mean, that's probably the best compliment, right? Is that even your practitioner is asking you for help with other people.
Yes.
Yeah. Joni wanted to say something.
Where's Joni? I don't see her. Can you wave?
I'm here.
Oh, where? Oh, there you are, Joni. Okay.
I'm in the upper left in my house.
I got you.
Where I am in Joyce. I'm getting ready to take, I think, the 3rd time this class. And one of the things I want to say, which, Dr. Millman was already talking about, is, you kind of go slow and you add things slowly. And what begins to happen is things start to fall into place. And the more you kind of have access, I mean, you have this access, so you can go back and listen to the presentations. You can just download slides or even just look at slides. A lot of times, what I like to do is really kind of understand the mechanism. And so I'll go back to one of the slides that Dr. Millman put up when she's talking about, for example, looking at bone health and heart health. And I'll just go to that slide and then I'll print it off, where I can really understand that the interrelationship and how it applies to my own health. And what I have found, which kind of Marty was talking about too, is so many of my friends, when I'm just sharing about what I'm learning and what I'm doing, they get all excited and say, oh, we want to hear more about this. And, for some, I could, try to get them to take the class. And for others, it's just kind of like pointing out certain things or just sharing some of the supplements I'm taking and why I'm taking them. And so, I can't recommend this class enough. And Margie, your classes as well. I'm signed up every time Happy Bones goes. Like, yeah, so these are things that, in terms of priorities, it's like it's really important. Both of what you folks are doing it's really important. And I know it looks like it's a lot of money, and yes, it is. But when you look at investing in your own health, investing in your life, it's a bargain. So I recommend people take advantage of this bargain. And both Dr. Millman and Margie are just unbelievable teachers, practitioners, and people. So can't thank you both.
Well, thank you for kind words. Oh my goodness, Dr. Millman. I'm so glad I really, right? I really got on Dr. Millman's case years ago. Like, you have to do this, you have to. But then should we switch to what Dr. Millman got me on my case to do? Thank you, Joe.
Sure.
I
Yeah.
like to switch to just tell people why you were the one that initiated this next part, which I don't know how many people are practitioners here, so we'll just quickly mention it for those, if there's anybody who's a practitioner. I still heard that there were a couple.
Yeah. Did you want me to start or you?
No, this was you. This was you. The other one, I initiated the help. I need more doctors. I want people. And that's when you said, I said, is there any way you can do a course that we could help more people, which has been.
Yeah. So really what I'm finding is that I have a 6-month wait list. We're booked until December. I don't even want to take patients that don't have bone loss anymore because this is what I want to specialize in. When we have people in Restore and Rebuild, some people just really, really want somebody to be taking them through and guiding them. And we really don't have any. We have a few people who we refer to. We love to refer to Dr. McCormick, but we wish we had more. And we really feel like we're coming upon a crisis, that more and more people need to be educated in this. More and more people are really looking for the kind of expertise, the deep expertise that we have, and that there is another way to do this, and we want to help educate other practitioners. So we are working on a certification course, and it's the first cohort is going to be in October. We are taking applications. We want to talk to people who are practitioners and see if any of you have the enthusiasm about working with these people like we do. And we are going to have a practitioner webinar. And I know we had a slide for the maybe Melanie could put up the sign up for the webinar, and it's going to be we're going to take a deep dive into lab testing so that even if the practitioner isn't interested in doing and it's going to be a 6-month long course, even if they're not interested in doing the 6-month long course, then they could get the content from the testing webinar. So maybe Melanie can bring up our
let's see. It's the one before that. Yeah, right here. Do you see that, Dr.
right.
Millman?
So Margie and I co-founded the Bone Health Academy, and we have this, and so you can go to the bonehealthacademy.com testing-webinar. There's a QR code up here if people are interested, and this really is for practitioners, and we're very excited about our new project.
Yeah, so if you're working already with someone who might be interested, we just want to share this. This is again for practitioners. So if there's already practitioners here, and you feel this passion, we would love to have you as part of it. And I
Yeah.
wish we could answer more questions. We've been going.
Yeah, I do too.
I know. I feel very badly. I want to help everybody, but but both Dr. Millman and I answer questions in our own groups, and this is part of R&R. After every module, there's a whole Q&A. So you get just like I wanted people also to experience this so they see if this is something they're interested in. Because as you progress, then you have the resources. That's what's so beautiful about not having a 2-day course or something like that, or having these live interactive sessions. You can really get your questions answered as you move forward. So it's really been
Yeah, I think people will say from R&R that, I do a pretty darn good job of like staying until I get most of, I mean, I don't know. I don't know how many times it's been that I haven't answered everyone's question. Not very many.
Yeah, you sort of over deliver, which I've learned from Dr. Millman, which is amazing. When I asked Dr. Millman about creating this course, I was like thinking, okay, great. I had no idea it would turn into what it is. And now that based on that course, we're teaching other practitioners. So it's just so exciting because we really know how many lives have been changed and how many people have found root causes so that they can stop the bone loss, improve their bones. And in the process, they've reduced their stress, increase their exercise, and right? It's so wonderful that they turn around, they say it's been a blessing in disguise because this diagnosis created so much positive things. And so that's what we're both interested in. So now that we're training practitioners, plus this course is available to educate the Restore and Rebuild. It's just, I don't know. I'm just so glad that we met and that we've been able to sort of push each other along and together create these things. And yeah, who knows what's in store? But anyway, so it's very exciting. So if any of this speaks to you, let us know. We'd love you to be part of it, both of them, and yeah, anything else you want? Well, how I end, is there anything else? I'm sorry we didn't get to everybody, but again, in our own communities, we'll continue to answer questions. And yeah, we did stay.
Well, and I also do Q&As with you a couple times a year, so.
Right. Dr. Millman will be back too. So that's another thing. So maybe you'll come back sooner than later and we can finish answering questions. No, but thank you.
I really enjoy this community, and I really enjoy hanging out with you guys for a couple hours.
It really is fun. It really is true. And the other thing is what you did tonight, though. You gave so many good tips. Oh my gosh, so many supplements, and you really, that's the thing. These are actionable steps that you can take. And so I think there was just so much value in all the things that you brought to the table tonight. So thank you so much. But how I end, everybody, we get you back on. So thank you for hanging out for 2 hours. This has been incredible. But what we always do for those people who've been in my community and come to classes, we always think of a word. I don't know, Dr. Millman, you want to pick a word? We all just end on a word. We say thank you. And I'm thinking of like empowerment or strong bones.
I was thinking empowerment or gratitude.
Okay, what do we like? Empowerment? Do we want to do both? Empowerment and gratitude? Should we do both?
Yeah.
Okay. So we'll say, thank you everybody for coming. really, I'm sorry we didn't get to every single person, but I hope you got things out of this. And again, I'll have Dr. Millman come back and we'll do more. And again, both of us in our communities answer questions. And this is Restore and Rebuild. So if you love this, we'd love to have you in the class because we have so much fun.
Sorry,
And
did you list all the resources? I'm sorry, because my phone died and I had to sign on to the computer late.
you want the
Yeah, Melanie, could you put them back up for us?
Thank you so much.
You're welcome.
Yeah, Melanie will put them up, and then tomorrow we'll get the replay. And I'll have you're all getting this replay. You don't have to sign up, you don't have to do anything. I'm sending it to everyone who is in the community. So you'll all
And
get
actually on the replay page, we have the links to Restore and Rebuild, and we have the links to the webinar sign up.
And then if you have questions also, Dr. Millman's office, Lauren is there and she can answer anything that if you have specific, am I right, Dr. Millman? If they have specific.
Absolutely, Lauren loves to talk with you.
Oh, great. Thank you.
So feel free.
And Dar is asking if there are any new modules in August. Dar, I don't think so. I don't think so because we've just been, diving headfirst into the certification program. So this is the one cohort where I think I won't be doing much updating.
But there's so much good from last time. Yeah.
The last time was a major update, but if Dar took it last time, then probably not. And a lot of people really want to come for the community too, and just to keep the momentum going.
Okay, everybody. So are you ready? We'll say bye, which is the first one we're going to say. We're going to say empowerment, gratitude. Well, thank you for hanging out. Dr. Millman, I can't thank you enough. You are always so amazing. And I always learn new things every single time I listen to you speak. So it's always so wonderful. And I've learned so much just from working with you all these years. And it's been so fun. So the fun continues, right? We also have fun. Where's your cat? Is your cat? Dr. Millman, I can't thank you enough. You are always so amazing. And I always learn new things every single time you speak.
Uh-oh.
I've learned so much just from working with you all these years. All right, well, we'll say goodbye then.
Okay, so I'll show you something.
Dr. Millman, I can't thank you enough. You are always so amazing. I always learn new things.
Okay, so my kitty.
Working with mute for. Just show the kitty, and then we'll say this.
Oh, she's asleep, but so her birthday it was a couple days ago, and she is gonna wear this on Saturday.
Oh. Cute. All right, we'll have to take a picture. Okay, everybody, ready? 1, 2, 3. Bye.
Bye, everyone. Much gratitude.
Thank everybody.
Bye. See you all later.
Bye. Thank you.
Bye. See you. We'll have to take a picture. Okay, ready? 1, 2, 3. Bye.
Bye. See you all later. See you later.
Bye.
Bye.